Alright, let's jump right in. We are here to talk about Brand UMI. Now, on paper, your brand should be a runaway success, right? It has got a powerful molecule, it's fully approved, it has everything going for it, and yet there is this hidden obstacle, this subtle challenge that is really holding it back. So today, we are going to unpack exactly what that is and, more importantly, lay out a really clear playbook to fix it. So it all boils down to this one really critical question. Why is a brand that is approved, that is in the guidelines, basically being left on the shelf? I mean, you have done all the heavy lifting. You've got the data, you've got the approvals. So what gives? Why is it not the automatic go-to choice for pediatricians? Well, the answer, it is not about the science. It is about something much simpler. Habit. There is a name for this problem, and we call it treatment choice drift. Think about it like this. It's kind of like muscle memory for doctors. When they face a decision, they just reach for what is familiar, the default choice, the thing they've always prescribed. They are not necessarily stopping to think through all the options, even the really good ones like yours. And that drift, that automatic pilot, is what is currently working against Brand UMI. And this is where you can really see the huge disconnect. I mean, look at this. On one hand, you have the scientific reality, the hard facts. Your brand is guideline approved for kids aged 5 to 17. It is clinically perfect for a PPI trial. But then you look at the clinic reality, what is actually happening day to day, it is getting overlooked. It's being pushed aside right at that crucial moment of choice, all because of habit and the way the clinic just runs. So let us be crystal clear about this. The problem you're facing is not about the science, it is about habit. You are not losing because another drug is better. You are not being outmaneuvered on efficacy or safety data. No, you're being displaced by the simple, invisible, but incredibly powerful force of habit. And this drift, it creates this kind of perfect storm of problems. First, you've got default dominance. The old habit is so strong that Brand UMI does not even enter the conversation. Then there is guideline anxiety. Doctors are a little worried about overusing PPIs, so what do? They stick to what they were. The familiar choice feels safer. And finally, here's the real kipper. Even when your brand does get chosen, if the trial is not run well, the medicine gets the blame, not the process. It's a vicious self-reinforcing cycle. Okay, so how do we fix this? Well, just marketing harder is not going to cut it. We cannot just shout louder. We have to be surgical. We have to find that one precise moment in the whole clinical journey where this choice happens, and we need to intervene right there. So let us pinpoint that exact point of impact. If you think about a typical patient visit, it really breaks down into 3 moments. Moment 1, interpreting symptoms. Here the doctor is just playing detective, trying to figure out what is wrong. Moment 3 is monitoring the response, but by then it is too late. The choice has already been made. It is that moment in the middle. Moment 2, initiating the PPI trial. That is the one, that is the decisive moment. That is our target, and I really want to emphasize this. This is everything. Seriously. Moment 1, 2 Moment 3, wait till it. The entire game, the entire battle for Brand UMI, it is won or lost right here in moment 2. That single point in time when the doctor decides to start a trial. So why is this one moment so incredibly critical? Well, think about everything that happens right then. The doctor decides if they're even going to start therapy. They decide which PPI molecule to use. They decide how disciplined that trial is going to be for the next 2 to 4 weeks, and they set the expectations for the parents. If Brand UMI is not the name on their lips at that exact moment, it is game over. It does not even get a chance to play. Alright, so that is the challenge. How do we win at moment 2? And the answer is not just throwing more money at traditional marketing. The real solution is to stop just promoting and start integrating. We need to build a simple, structured workflow that gets embedded right into the clinic's process. A workflow that makes choosing Brand UMI not just an option, but the smart, disciplined, and frankly, the easiest choice. And here it is. The framework is beautifully simple. Teach, verify, track. That is it. TBT, it's a super straightforward 3-step process, and it is designed to do one thing: build the confidence and the discipline needed to make Brand UMI the go-to standard for a well-run pediatric PPI trial. Let us break that down. First up, teach. We provide Academy-certified educational modules that remind physicians about the guidelines, about the discipline needed for this specific patient group. Kids 5 to 17. The key here is that this is not a sales pitch. It's pure education on the right way to do things. Next, step 2 is verify. We give the clinic a really simple tool called a parent care link. This is all about empowering the parents. It makes sure they know exactly how to give the medicine, the right timing, the right diet, all of it. This cuts down on confusion and stops them from giving up on the trial too early just because of a simple misunderstanding. And finally, we track. A simple 4-week tracker helps the clinic and the family keep an eye on how things are going. Is the medicine being taken correctly? What is the progress? This gives everybody, the doctor, the parent, the kid, confidence that the trial is being done right, which gives Brand UMI the best possible chance to actually work. So what is the end result of all this? The TVT framework creates a massive shift. Brand UMI goes from being that overlooked secondary choice to being the consciously chosen standard. It goes from being ignored because of old habits to being built directly into the clinic's everyday workflow. It's a total game changer. You see, this is about more than just fixing a sales problem. This is a genuine path to leadership. By becoming the brand that champions a better, more disciplined process, Brand UMI can actually set a whole new standard of care. So how do we know it is working? Let us talk about measurement. We are not just going to look at raw prescription numbers. We are going to measure the change in behavior. Are doctors actually doing the training? Are clinics using the parent care link? Is your prescriber base getting bigger? These are the signals, the leading indicators that tell us we are actually changing minds and habits right where it counts, at that decisive moment. So if you remember one thing from this, let it be this. The way forward for Brand UMI is not about trying to find some new point of differentiation. It's about owning the process. It is about becoming the champion for disciplined, by-the-book execution for the patients you are already approved to treat. Look, this playbook gives you a clear step-by-step plan to break that cycle of habit and to put Brand UMI right at the center of the clinic's workflow. It's all laid out for you. So the only real question left is, are you ready to put it into action and take back your brands, right?